We want to thank everyone that's joining us tonight. I see people rolling in. We're just going to give it 1 or 2 more minutes. We have a decent crowd already here, and then we'll get started. Looks like the participants have leveled out, so now is better than ever. Just a quick introduction. I'm Brian Cush, one of the board members of the BART Foundation. We'd like to welcome everyone to our webinar series. The BART Foundation presents a continuing series around alternative therapies for brain injury survivors. This series explores safe alternative therapies for brain injury with leading practitioners, topics including hyperbaric oxygen therapy, craniosacral therapy, photobiomodulation, neurofeedback, and nutraceutical supplementation. The BART Foundation hopes these lively interactive webinars encourage attendees to raise questions, express concerns, and learn about cutting-edge approaches to treating TBI and ABI. Tonight, you will be hearing about neurofeedback in TBI management, evidence-based approaches, and best practices. We're also joined by Joel Goldstein. He's a parent of a TBI survivor, author of No Stone Unturned, and the executive director of the BART Foundation. He will be joining us after the presentation to help moderate the Q&A session. A few small housekeeping items before I introduce our speaker. The webinar is being recorded, so we will have this emailed out afterwards. Look out for emails for any upcoming webinars as well. And we do request questions to be submitted via the Q&A in Zoom. If you're unfamiliar, kind of the bottom panel, the menu section is a Q&A that you can submit questions. We will hold them to the end and do our best to try and answer everyone's. I'm very excited here to introduce Dr. Ron, and he does happily go by Dr. Ron. He's the director and chief scientist of the Houston Neuroscience Brain Center and founder of the Clinical Neuroanalytics LLC. His organization specializes in neurology, EEG interpretations, QEEG reports, and neurofeedback protocols for over 20 centers nationwide. Dr. Ron serves as the chief consultant for 2 centers focusing on neurofeedback for personal injury cases related to traumatic brain injuries, as well as military and veteran Tier 1 operators. Be prepared to learn many insights throughout, and welcome Dr. Ron.
Thank you very much. I appreciate it, Brian, and good to see you, Joe. All right, let's get going with this. One of the things that I really like to work with, and I love this DTI image of the brain, and this is how I view the brain because all the connections that they have. Tonight we're going to talk about how to promote healing, how to reduce neuroinflammation, how to rewire the brain, and the advantages of interlacing these treatments. When I came across the BART Foundation, I thought it was very fascinating that a lot of the things that I use in order to address and how to bring the brain back to more functional level was part of their underlying premise, and I like that. Okay, so brain injury. To promote brain healing, we need complete cognitive rest during the initial phase following the impact. And so many times I run into these cases, and whether it's high school students and it's in football season and they got to study for finals and everything else, and they've got a substantial knock to the brain. I found it quite interesting this year was the highest death rate from brain injuries on the football field. From August 6th, we've had 6 young guys die from brain injuries, not just get brain injuries, but die from brain injuries. And that's devastating. So the healing time is individually inversely proportionate to cognitive rest. So the more rest you get, the less time it takes you to heal. The more you keep pushing, the more you keep trying, the more you go back to the field of play, and the longer it's going to take you. And the brain has a way of killing parts of itself in order to promote its own healing. Just a little history on myself. The reason I got into this line of work was because of when I was in high school playing football in the late 60s, early 70s. I had 6 major concussions playing high school football. In fact, we did drills specifically to see if you could knock somebody out. Never did we know about brain injury back then. And my whole junior and senior year were filled with all sorts of uh, anger, all sorts of. I became a very violent person on the field of play. I loved to hurt people and didn't realize this was part of the brain injury. And then by, how it comes with the depression and the anxiety and everything else, my mother was the enemy. And it took me to a lot of places. So when I went to college, when I didn't get a scholarship, I was not in any way, shape, or form ready to do college level work. And so within the first semester, I hardly went to class, and I ended up with a 1.23 grade point average, and they pulled my draft deferment away from me, and that's when I went to Vietnam. So that was how I got. That was my school of hard knocks to get me into brain injury recovery. The phase for healing takes from days to weeks to months, depending on the severity and the cognitive challenge that we put ourselves under. Brain injury and blood perfusion. This is one of the things that I think we really got to focus on. Brain injury controls its own blood supply through dilation and constriction of blood vessels. Perfusion is measured as a function of blood flow and utilization of oxygen and glucose. Reduced perfusion occurs from swelling and inflammation. So this inflammation part is very critical. This results in diminished oxygen and glucose support for the damaged area. I've taken this presentation and condensed it. I presented to a set of attorneys in Washington State about treating traumatic brain injury. So I wanted to bring it down to the level to a point that we could put it into the time frame of this presentation. This was like a 3-hour lecture. So oxidative stress and inflammation and the reactive oxygen species and apoptosis. These are all very important parts about brain injury, and I'm probably preaching to the choir here, because if you've been involved with this organization, you've probably heard a lot of this stuff, but I have to lay the foundation. In a healthy person, the brain would produce antioxidants to counter the effects of oxidative stress when you get a brain injury. The brain cannot produce enough antioxidants to protect itself. Reactive oxygen species induces oxidative stress and has a fatal effect on the brain after traumatic brain injury. So to reduce neuroinflammation and reactive oxygen species, so this is the part where I think we all can understand there's 2 components to working with brain injury once you get to the part past when you should be just doing total cognitive rest. We got to treat the inflammation first, and then we got to rewire the brain. Rewiring the brain with neurofeedback without treating the inflammation first is a long process, and we've been able to cut our treatment tremendously by doing photobiomodulation. Is what we use in our office to treat brain injury. Photobiomodulation acts to reduce the swelling, increase antioxidants, decrease inflammation, protects against apoptosis, which is programmed cell death, and modulate the microglia activation state. These mechanisms of action suggest that photobiomodulation delivered to the head can be beneficial in cases in both acute and chronic traumatic brain injury. We use it a lot. Photobiomodulation has the ability. Now, what that is it's a apparatus you put on your head, and it produces 810 nanometers of near infrared light, which penetrates into the skull, down into the within. It says 5 millimeter penetration into the skull. And then we use a nasal piece that actually goes up through the subcortical structures, and it gets the pituitary gland, because the pituitary gland often gets damaged in head injuries. And so what the photobiomodulation does, to make it simple, is it actually works on the health of the mitochondria. The mitochondria is a part of the brain that powers the brain. It's the fuel cell of the brain. So the mitochondria itself is very important. And what I see in these EEGs that I do with people, I do EEGs of quantitative EEG brain mapping, is that their microvoltage coming out of their brain has decreased with the health of the mitochondria going south. Mitochondria is critical because with photobiomodulation, what we're doing is actually reconstituting the mitochondria, increasing its ability to release nitric oxide. Nitric oxide is a chemical that's critical in the reduction of the reactive oxygen species and the oxidative stress. So when you think simply about inflammation in the brain, why people have such sleep issues following a brain injury, why they have such impulsivity and overreactivity and everything else, is because your mitochondria has taken a hell of a hit. And in that process, it actually reduces its ability to, to do its function. So if you think about it, in a severe brain injury, in a brain injury, even a concussion, uh, you're going to have a period of time there where we actually end up destroying the trash truck and the garbage collector. Basically, we're stuck. What you in COVID, the neuroinflammation they refer to it as um, is a backup of these waste particles in the brain. So you lose your delta stage of sleep. You lose your ability to for the brain to flush the waste products down to the spinal cord at night when you're sleeping. And so when you lose that ability, you end up with what they call brain fog. And this is what we have in brain injury. So this is the part, it's only regarding the inflammation. Now, the inflammation, you wonder why you get headaches. It's because the brain becomes inflamed. A study we just submitted 2 weeks ago, one of my colleagues is actually on this presentation tonight. The author, the primary investigator of this study, we found that in the brain you have bony projections in the temporal lobes. So when you get hit, that brain bounces around, you get a coup, contra coup, but the bruising occurs where those bony projections are. And we were able to prove this in our study that this is where the inflammation is different than the inflammation you would get, say, for instance, from a COVID infection that crosses the blood-brain barrier. So photobiomodulation is critical. We really have to address that. The hyperbaric oxygen treatment is another thing that I've been working on for years. I actually published the first study about combining the hyperbaric oxygen with neurofeedback in order to uh, uh, decrease the healing time for brain injury and increase the efficacy of what we've been able to prove. I've got a study going on right now in Bahrain, and it was actually presented this weekend at a conference when we were the first to do a hyperbaric oxygen neurofeedback session at 2 atmospheres in hyperbaric oxygen. And so we're doing a study right now showing that the combined neurofeedback with hyperbaric oxygen has great potential, not just for brain injury, but stroke, which is also a brain injury. And then in December 2022, a medication came out, guanfacine, which is an old blood pressure medication. And they said guanfacine plus NAC, N-acetylcysteine, protects the mitochondria and reduces, this backup of garbage in the brain. So guanfacine is a old blood pressure medication which vasodilates, which brings in more blood into the brain. And this is what helps the healing. And we've used it successfully with this biomarker we have identified as spindling excessive beta. So hyperbaric oxygen. We really like hyperbaric oxygen. This is one of the chambers that I actually have. It's a soft chamber. The chambers we were using in Bahrain were hard chambers at 2 atmospheres. This is only a 1.3 atmosphere chamber, but the normal course of treatment is 5 days a week for 4 weeks, and the dive time is 60 minutes, breathing 95% oxygen from a non-reed breather, which only actually puts in about 45% oxygen in a mask at 6 to 8 liters per minute. Photobiomodulation, this is one of the tools that we use specifically for stroke because I can put the diodes exactly where I want in order to promote microcapillary blood flow around the damaged area and increase the healing to that area. I just really like how the whole thing works together. Medication considerations that affects the brain. Brain injuries often create isolated epileptiform discharges, which we call IEDs, and seizures. Anticonvulsants help to stabilize the brain. So when we're looking at medication considerations, anything that would lower seizure threshold would make the brain discharge worse, would make it more unstable. So you're talking about all the stimulants, all the SSRIs, all the SNRIs, all the SNRI NDRIs, all the medications like this, lithium, antipsychotics would lower seizure threshold. So anything that they would put on you in order to try to treat a brain injury, there are no medications found yet to treat brain injury. And that's why we really have to stay away from the ones that would increase the excitatory nature of the brain, and most medications do that. Methods to rewire the brain. So first we treat the neural inflammation, then we rewire, and we can do them simultaneously. In my brain injury work that I've been doing with litigation cases and car accidents or any sort of brain injuries that happen where they're going to court. So these are bona fide serious brain injuries. And, first of all, we got to do the neuroinflammation. So what we've been doing is set up our program. We've got what we call brain camp, and we do double sessions 5 days a week. So instead of training the neurofeedback for 35 minutes, we train it for 70. And before we start that, we do the photobiomodulation for 20 minutes with this one other photobiomodulation piece of equipment called a V-Light. This, and anybody has questions on this, I'm glad to dig into it deeper. But this piece has tremendous ability. So we get the brain ready for the neurofeedback training in the first 20 minutes so that we can actually then rewire the brain. And the brain we see in litigation cases is post 2 months to 2 years past their accident. I've actually trained people 7, 8, 10 years past their brain injury. And that's the one I published. And if anybody wants a copy of that publication about combining neurofeedback with hyperbaric oxygen and a severe brain injury, I'll be glad to send it to you. And what we use is the EEG that detects the abnormalities and tells me where exactly the slowing has occurred. When a brain is injured, it slows its frequency down, and in that specific area, then once it's slower than the rest of the brain, it disconnects itself. So what we want to do is reconnect it. So I've got to speed up that slow area so it connects itself back into the rest of the brain. And a quantitative EEG brain mapping is a way that we use to actually quantify how serious the deviation is from the norm, because it compares it to a normative database. So this is what we call EEG QEEG guided neurofeedback. I do not believe, nor do I support neurofeedback based upon symptoms. And I'm trying to get everybody to say we need to personalize all our treatment based upon the individual's brain, not based upon a set of symptoms that they're exhibiting. So that's my personal little soapbox I'm going to get on for a second. So the purpose of EEG and QEEG, my EEGs are interpreted by a neurologist who is board certified as an electroencephalographer, and both of them are epileptologists as well. And the common findings we find in the EEGs of those that have brain injuries are isolated epileptiform discharges. So if you think about the brain that has been impacted tremendously, you've had that part of the brain, the neurons fractured, twisted, torn apart. And when they try to reseal the blood-brain barrier, it tells all the associated neurons around that area to die so that it encapsulates it and separates it and reseals the blood-brain barrier. So that process, now you have a set of neurons over here that we're firing together and a set of neurons over here firing together, and there's a lesion, there's a scarring between, and it can't. So just like power lines, when they're broken, they hit the ground, they're arcing, they're trying to reconnect. And that's what happens. That's what a spike and wave action is. It's trying to connect across that gap that there's no continuous connection as there once was. So isolated epileptiform discharges, that's why some people who have serious brain injuries can actually develop seizures. Encephalopathy, you heard of chronic traumatic encephalopathy. You can throw the brain so far out of whack that you have the chemistry's off and everything else is off. This is really an issue with some of these severe brain injuries. Now, spindling excessive beta is the paper we just wrote that we feel is an EEG biomarker for inflammation. And this is some of the findings that we find in all brain injuries. I compared a study that I published with 1,233 cases where we had spindling excessive beta was found in 31.5% of them. When we compared it to my brain injury group that was sending me their cases that were all litigation cases, nothing but brain injury, we had 80%. So showing that brain injuries cause neuroinflammation. And so this was a great finding. This is what put us on the path to get this paper published. Focal issues such as tumors or lesions or breech rhythms, that's some of the other things that we could find during our EEG analysis. The quantitative EEG compares the patients to a normative database, and it can quantify and identify the location of the focal slowing. So the QEEG and EEG data provides insight as to what medications to avoid and which may provide health. That was my paper that we did in 2020, just January actually, about 1,233 cases. So neurofeedback to treat traumatic brain injury. There's two ways that neurofeedback helps. By putting the electrodes right over the area we want to train, we're actually creating what we call neutral positive perfusion, adding enough strain on the brain to provide a little bit more oxygen than than it's actually producing, without overdoing it and causing a collapse of the blood vessels. So we want to actually encourage more microcapillary blood flow, more blood around the area. And then neuronal plasticity, as you heard, the brains are very plastic. They can rewire themselves depending upon the input they get and the feedback that is given. These abnormalities are caused from a reduction in blood flow and perfusion, which reduces oxygen and glucose to the injured area. Other neuromodulations to reduce focal slowing, transcranial magnetic stimulation, which has to be done with the psychiatrist and psychiatrist office. That's one of the ways, and they actually will use, now they use an EEG to guide it. They're using functional MRI to guide it. I was just at Menninger last week talking to one of the doctors over there, and how he works with the brain injury work, and how he actually used functional MRI to identify the source of the slowing so that he can go in and use target his magnetic stimulation there. And transcranial direct current stimulation, which is where you put tiny little microvoltage into the brain. I started out doing this, and then as a PhD, not an MD, I thought, I don't want to put any electrical current into any brain myself. I think that's above our pay scale, and I'm just not going to go there. So for the rationale for interlacing the treatment, neurofeedback amplitude training reduces abnormal slowing and promotes new pathways in the damaged area. Photobiomodulation promotes microcapillary production and reduces reactive oxygen species. Combining the two, neurofeedback and hyperbaric oxygen, improves overall functioning, increases plasticity, and results in healing of structural damage caused by the TBI. Both neurofeedback and hyperbaric oxygen both separate and combined show promising results. And this is the paper that we wrote, published in 2022. So, rationale for interlacing physical therapy, occupational therapy, and speech therapy. Repetitive exercises using these three therapies influence neuronal plasticity to reconnect the pathways that are damaged or destroyed and when the brain is injured. So when I'm working with PTs, OTs, and STs, I can lay the initial pathways doing neurofeedback, but what they do afterwards with the physical therapy, the occupational therapy, and the speech therapy really does exercise and reinforce those pathways that we've created with the neurofeedback. So in summary, healing the brain can be enhanced by complete cognitive rest. Please, anybody get a head injury, just let them have rest. A couple of weeks of rest is probably the best thing in the world to heal the brain injury correctly. Hyperbaric oxygen, photobiomodulation, definitely to treat that. Alpha-2 agonist, guanfacine, a medication, the only medication found to help with COVID brain fog, neuroinflammation. It works great in brain injuries. And rewiring the brain with EEG, QEEG guided neurofeedback, amplitude training, transcranial magnetic stimulation, transcranial direct current stimulation, and PTOT. they all work well together. We think that a multidisciplinary approach is truly the way to approach healing brain injuries. Takeaways: initial cognitive rest, reducing inflammation, increasing perfusion, rewiring the damaged connections, and enhancing those new connections. So now it's up to questions, and I know that Brian has some. I've kind of sped through this, but I want to leave plenty of time for questions because I know I overloaded you with a lot of information. In my PowerPoint presentation, Brian, you feel free to share it as long as you seal it as a PDF. That's good with me.
Well, we appreciate that information-packed roller coaster ride.
That's what you asked for.
Joel, is there any of the sample Q&A that you'd like to start with?
Well, one thing, first, thank you very much, Dr. Ron, for that very instructive and useful whirlwind presentation. I like to always start with this question. Are there any counterindications, any brain conditions which would not benefit or might even be harmed by this kind of protocol?
Any brain conditions even outside of neurofeedback? I mean,
Yes.
outside of brain injury?
Yes, outside of TBI and stroke.
Alzheimer's, we cannot do very much to help Alzheimer's. We can slow down the progression slightly, but that's one of the very most frustrating areas I've ever tried to help. Now, dementia, we've been doing great work with dementia. Parkinson's, that's another area. Multiple sclerosis, that's another area that we haven't done that well with. And in my opinion, we can help optimize what's there to help make more functional, but it's just not an area that I think is our strong suit. Our strong suit by far is the brain injury when you're talking about getting some really phenomenal results back with.
Interesting. You should mention Parkinson's, because Anita Saltbach, who you may know, she works with V-Light among others. She's been focusing on Parkinson's and Parkinsonians and finding some good results, and is very excited about that. So I guess we'll have to wait and see.
And I do think photobiomodulation, by its nature, is going to help everybody. Getting near infrared light into the brain is really beneficial. But as for having the same results we have in neurofeedback, I just haven't seen it. That's been my experience.
How long, and then I want to open it to other questions as well, but probably the most common question we get here at the Bart Foundation, besides where can I find these therapies, is how long after injury will it still help? We get people who say, look, I was injured 20 years ago. Has the inflammation and other catabolic processes done so much damage that it's now too late? What do you find?
I've worked on cases up to 15 years, 20 years. I still think we can help to make the brain more functional. The critical thing that I see in so many cases is that their sleep is totally destroyed. And with the photobiomodulation, if we find the spindling excessive beta, that's one of the first gains we make, lowering anxiety. I've done a lot of Iraqi veterans, and I found that when 7, 8 years post TBIs, we're talking blast injuries and shrapnel injuries, that the brains do respond very quickly. Of course, these are young, healthy males mostly, but we know that in the industry, and this is in the literature, the brains that can come back the quickest, have the greatest potential for healing, are young, female, left-handed, with a positive attitude. They seem to be the ones, they got more cross-hemisphere wiring. They will come back quicker than anybody. It's just amazing.
Positive attitude. Brian, I don't see the questions that may be coming in, at least on my screen. I have plenty more questions, but have you got any coming in from the outside?
Yeah, I do want to recognize the initial actually was kind of a paraphrase of your question of question asking of, I think it's been 30 years since my injury. Does that length of time matter, and can you still treat, which I think you kind of directly answered there. Even
Well,
reckon.
I want to follow up with that. You know, the my brain injury was in the early 70s. I graduated in 1971, so it was late 60s, early 70s. And it's interesting that the brain has the ability to rewire itself over a period of time. I jokingly say that 150 hours of college will probably heal any brain injury you got because you're really hard to press it in that kind of area. Joe's laughing. But in the School of Hard Knocks in the military really helped me also. But uh, so we will always see abnormalities in brain injury people that may not have any credence. Right now, the left posterior temporal part of my brain, we did an EEG on it. It still looks to be atypical. However, it's rewired itself. It's wired itself around the problems. If some novice neurofeedback therapist went in and saw this big red spot back there in part of my head and said, oh God, we got to train it, I'm a public speaker, I'm an author, I shouldn't be able to speak or read because the damage looked like what it looks like back there, but it has rewired itself. So one of the critical things that I tell everybody, we must have clinical correlation to match the abnormal EEG and quantitative EEG findings in order to treat it, because my adaptations are perfect. Leave them alone. Don't mess with it. But if there's other issues going on, that could be created post or now the process of the brain killing itself is quite interesting. If you keep cognitively pushing after you had a brain injury, the brain has got to kill non-essential parts in order to heal. It takes 2,500 extra calories a day in order to heal the brain. And a lot of people in comas will become emaciated because they're not feeding them enough food in their tube feeding. It is incredible the amount of energy it takes to heal the brain. And so when it starts killing these remote areas that it considers are non-essential in a programmed way, and the way it programs for males is different than females, because we don't even have the time to go into that. But it's just interesting how the whole thing works. So understand that the brain can heal itself and still have abnormalities that are sticking out there that we can help and optimize the functioning of every brain. So that's what I say to that. There's always things we can do, even 20, 30 years post, that I think can make, but we will not treat something that's been rewired effectively.
No, I appreciate that distinguish. I want to recognize there was a really nice comment from a gentleman just saying that he can attest that after his brain injury, neurofeedback was the best and most effective treatment to get him back from his injury. There's kind of a sandwich of comments here that I think might be directed a little bit more towards you, Joel, and just the foundation in general from a resource perspective, really both asking about one specifically is doctors and resources around this treatment, photobiomodulation, and more just broadly where to find facilities that incorporate multidisciplinary treatments.
Okay, well, I'll do the best I can. Of course, you should go to our website, which is thebartfoundation.org. There's tabs along the top of it, and one of them is called Therapies. They're drop downs. And each of the therapies that we're interested in, including photobiomodulation and neurofeedback, gives some lookup resources. I should say, and I want to give a kudos to Dr. Ron, very few actually practice and recommend combining therapies. They tend to be specialists. If they're about HBOT, then they are always, for the most part, about HBOT. I can think of one fellow on the East Coast, Marvin Berman. I don't know if you know him, Dr. Ron, but he's using neurofeedback and photobiomodulation. Anecdotally, we do hear from some practitioners who are doing more than one at a time, and we usually hear that it enhances, not surprisingly, each. But this is an emerging movement, you might say, and early emerging, and Ron is a pioneer in that. But I recommend going to our site. Some of the resources, for instance, especially the ones on hyperbaric oxygen, there's 4 or 5 lists. I especially recommend taking a look at the one that was developed by treatnow.org. You'll see it listed. They're a veterans advocacy group, and they have over 150 HBOT affiliated centers around the country. Of including quite a few in Texas and Oklahoma. And they will treat veterans for free, veterans with brain injuries. And they generally treat the rest of us at steeply discounted rates. So that's a start. And if you go to our site and you don't find what you want, there's a query button, and you can ask, and we'll do what we can to find something for you.
Well, one point that I want to make is that photobiomodulation, which we use in all of our brain injury and stroke cases, you can buy this equipment. You can purchase it yourself. I mean, it would be nice if you knew whether you needed the alpha or the gamma. It would be nice if you had somebody that could do the EEG and kind of make that recommendation. But for the most part, just as a general speaking, if it's not for dementia, the V-Lite Alpha would probably be the best one. And there is you don't have to keep paying for somebody. And if you've got that and it can help reestablish your sleep, I've worked with the NFL players, and the NFL players, it's like I talk to them, it's like, get your own hyperbaric oxygen soft chamber. You can afford it. Put it in your house. Use it daily. Get your photobiomodulation. Don't do the photobiomodulation hyperbaric oxygen. That's kind of like we don't want to introduce any sort of electrical stuff in there. But it's tremendous what you can do for yourself. And treating the inflammation is so critical. Now, why do we have so much inflammation? Why is it not returning to normal? That's a question that often comes up, because why do we have such chronic inflammatory diseases right now, which include a wide variety of things, including your arthritis and everything else? And I believe it's because we have migrated from an outdoor creature, primarily, to an indoor creature in the last 100 years. And Darwin says it takes 14 generations for us to adapt to a new environment. And I guarantee you, COVID took a big hit in keeping us out of the sunshine. Totally the wrong thing we should have done. So the sun has near infrared light in it, full spectrum light. You spend 30 to 45 minutes outside in a day in the sun, in early in the morning, mid-morning to afternoon, you're going to get near infrared light. You're going to get all the photobiomodulation you need. And you don't need to sit there and burn. 20 to 45 minutes is plenty. And it will be very healthy for every individual. So this is what you can do for yourself without having to pay an arm and a leg. This equipment's not that expensive. And I think Joel's got something he wants to show you there. He went.
I want to show you. I have, I don't want to advertise them, but they're an excellent company, Canadian company, V-Lite. You can see how little it is. It's the intranasal device. And I had a year or so ago, when I purchased this, I had a bad case of COVID, some brain fog. We lost our son of 37 years, light of our life part. And I was in a bit of a funk. And I did consult with some of the people at V-Lite. I didn't think I needed a major device. And I've been using that every other day. And I've also been taking a lot of sun, take long walks with my old English sheepdog. And I'm feeling way, way better. And moving on with, lots of interesting projects.
And just to let you guys know, and I'm sure Bart doesn't have any vested interest in V-Lite. It's just.
No, not at all.
Not
or
at
anything
all.
else.
Do not, but I just recommend what I know works. And if I can help save somebody some heartache and trying to get into a center and everything else, we're actually doing a study right now in Cincinnati, Miami, and Houston on treating stress epilepsy with V-Lite. Photobiomodulation. It's $1 million funded study. And so we've got to the final part of IRB right now. We're getting ready to kick that off, but it's really, and that's what it's for. It's to lower the oxidative stress in the brain. Very, very healing for everybody.
Yeah, we appreciate that explanation. It was funny. You must be a mind reader. One of the questions was asking about whether you had to be a doctor to operate the photobiomodulation system. So kind of directly addressed that one, and kind of want to dovetail it, I think, in pressing into it a bit more. Another question came through around someone that has been doing biomodulation, watching what they eat, sleeping while taking supplements. Is there additional kind of areas that you encourage your patients that they can be proactive and kind of self-starter around?
Sure. When we talk about brain function, they've got this term called cognitive transient impairment, quite prevalent in the brain injury world. And there's three things that we know can make a brain function worse. Number one, by far, is sleep deprivation. Anybody with a brain injury has got to know the most important thing you can do is reestablish your sleep. And that's why I like photobiomodulation. Another company that I don't have any vested interest in is the Aura Rings. We're using that in our study to actually measure all the physiology of the people as we're putting them through this treatment. Aura Rings are great to monitor your sleep, monitor your blood oxygenation at night, your movements, and everything else. I think it's critical to everybody's health, and I think most males and many females would rather see data than they would see just, well, how do you feel on some sort of psychometric. And so that's the number one is sleep. Number two is intake. The brain needs fuel. Skipping meals, going hypoglycemic, eating high sugar, high carbs, and having a blood sugar crash is just detrimental to the brain. And so you want to maintain your blood sugar levels throughout the day. And eating a keto diet is probably, or a Mediterranean diet is probably the healthiest way you can. And there's a book out on concussion rescue, I think it's called. I'll send a picture of it to Joel, and he can post it. But it's a very good about how important it is for the omegas. Again, you're trying to give the building blocks to help this brain repair. Give it what it needs in order to repair itself. So intake's number two. Number three is hyperstimulation. So the brain is trying to heal. It's interesting that veterinarians know how to heal brain injuries better than medical doctors. What do they do with a horse that has a brain injury that bucked up and hit himself on a trailer or something like that? They put him in his stall, they dim the lights, they muffle the sound, they give him plenty of food, plenty of good grain, and they leave him alone. And that's the best treatment in the world. Total cognitive rest is what it's all about. And so that's what we got to think. This brain, if you get a broken arm, you're going to immobilize it. You're going to keep from moving it. When you get a broken brain, how can you put it in a sling? Well, you got to, as parents, you need to put your kid into a sling and don't give them a bunch of video games and stuff to read and TV. They're tired. Put them in a room, let them rest. Best thing in the world to treat a brain injury is cognitive rest. So I just want to make that point that we will immobilize an arm for a broken arm, but we don't immobilize the brain. That doesn't make sense. So just a point I'd like to make with that. Any other points out there that or questions that came up?
There's one that I'm taking of almost just taking another pass at the devices. One of the questions was just really asking, there's been so much information that's come through in the last 30, 40 minutes of, is there another succinct pass at the devices you recommend for home use with someone?
Well, there are remote training neurofeedback devices. I think they still should be. I do not want to ever treat anybody with a brain injury that I haven't had an EEG and a brain map on so that I know exactly where the damage is and how to set the protocols. I do not recommend automatic systems that are supposed to analyze you. The normative database that they use for Q maps, the IQ is in the normative database is between 95 and 105. Well, the people that come to see me are a lot sharper than 105 IQ. So those live Z-score training systems and everything else will dummy you down because you're not supposed to have alpha that's around 11 hertz. You're supposed to have it around 9 hertz, 10 hertz, So it's like you really have to hook up with a good practitioner that knows what they're doing, that's been doing it for a while. They should be BCIA certified, biofeedback certification, International Alliance certified, so they had a minimum level of training. I like how you asked the questions when you wanted me to come and do this kind of presentation. What's your history? What's your experience? What's your certifications? I think you got to do your homework on these people and make sure they know what they're doing. And even if they don't, if they're having their data processed by somebody like me that knows what they're doing, it doesn't matter. They're technicians. They can do the prescribed protocols, not a problem. But we do have remote home training neurofeedback systems, and I like it for my brain injury people because brain injuries respond better than to the minimum recommended for the industry is 2 sessions a week. For my brain injuries, I'll do double sessions 5 days a week for 2 weeks and get tremendous results because the brain will train that fast. So brain injuries often take more than 40 sessions. Sometimes they can take over 100 sessions to get to that point. But when we combine it with photobiomodulation, that 20 sessions, I'm getting people back to work in 20 sessions with doing photobiomodulation first. And their sleep's reestablished, their anxiety's down, and everything else. And these are litigation cases. These are serious brain injuries. And it's because we're taking that approach to address the neuroinflammation first and then rewire the brain at the same time while establishing their sleep, because the photobiomodulation, sleep is critical.
I appreciate you taking a crack at answering that, and to address even the listener that submitted the question, we will release a recording of this call if it didn't directly answer and lay out everything you're looking for. We always link to the resources. We link to anything that we're recommending in this as well. So don't hesitate to engage the BART Foundation website and even submit there further as well.
Sure, and I'll be happy to answer questions after the fact if something comes up that they put after this or people that listen to it in the future as well.
There's a question that just came through. It says, what is your opinion on the C15 zero supplement? Is that something you can speak to?
Well, I tell you, there's a lot of research out there. This concussion book I talked about, it talked about those with the best research. I think, that we have to understand when you have a brain injury, there's a big need for the omegas. I always caution people, please, the best sites to go and look up if a supplement's been tested or been verified is go to PubMed, Medline, and enter the National Institute of Mental Health Data Archive. And if it's a reputable journal and people have published on it, see what kind of publications there's been on it. I think there's a lot of things that may have great potential to help, but the problem is the people who are touting these things aren't publishing their research or doing peer-reviewed conferences in them. I think that's absolutely critical if we're going to trust something. I didn't trust photobiomodulation for the longest time until the research caught up, and then it's like, okay, my predecessors were all out there and they were right. It does really work. But do your homework and make sure that we're not just somebody's hawking snake oil, and see if there are published studies in it in reputable journals, because a person can go out there in a predatory journal and get anything published, but it's not real science. It's junk science. So that's why I say PubMed, Medline, National Institute of Health Data Archive. If it's a reputable supplement, type that word in on a word search and see if it comes up. And then there may be a case study or a couple of case studies and things like that. And if you think it's worth it, I think that we're all an N of one. I try something for 30 days. If I get a positive benefit from it, I may keep with it. If I don't get anything from it, I'll crash it and go to something else. I don't think you shouldn't try it, but again, do your homework and make sure that the ingredients in it have some sort of validity. I know there's a lot of people out there right now. I saw one guy the other day, he was saying he was a neuroscientist, and I looked him up and he had one little study, one he related. And I'm going, I don't think you're a neuroscientist with one little study, but he talked a good game. So, marketers, I question all the time. I think they're more interested in selling stuff. If you're an independent scientist, you're just testing it, I trust those guys more than anything, because they're just saying, okay, I'll try it. I had this one product it said it would make alpha waves. I'm going, I don't know how that's possible. And so I had the company send me a bottle, and I tested it on a 17-year-old female, had no alpha. And guess what? She was making alpha. I went, I wouldn't have expected that. But in this one case, it does seem like it does make alpha, because I could do her EEGs pre and post. And I was kind of, okay, so I have the ability to test things like that, and a lot of people don't. So I say, please just look up the research on it, the hardcore, not what they're saying the research is. Go research our product in PubMed, Medline to see if it's valid.
Brian, if I could just pop in and mention the book When Brains Collide. When Brains Collide by Dr. Michael Lewis. He's a board member of the Bard Foundation, full colonel in the U.S. Army when he mustered out. And he's done a lot of work on omega-3s and presents most of the research there.
Wonderful. Is there any other questions you have, Joel? Yeah, I think we kind of gotten to address
I think we've
all that have
wrapped
come
up
through.
time-wise, so I'll have to ask Doc Ron on my own sometime. But sure, this has been terrific and very, very useful, I hope, for all of our listeners, present and future.
Well, this has been
Yeah,
an enjoyable conversation. I tell you, I really respect what you're doing there. We've got to get the message out, and I know there's a lot of families that people have said to them, doctors have said to them, there's nothing more we can do, and I think that is BS. There's always something we can do to help a brain function better, and I'll never give up on trying to help people who have had, severe brain injuries, and I've seen some almost miraculous things happen with the worst cases. So I had a young girl once upon a time, tell you this last story. She was 19 years old, straight A student, college, and she had a seizure in her sleep. Her roommate found her. She was without oxygen for 9 minutes. Severe brain injuries. Short-term memory was so bad she could go to a movie with her parents, and she wouldn't even remember when she got out of the movie that she went to a movie. And so her father was an attorney here in Houston, and he brought her into me, and he said, I heard you do neurofeedback. I said, yes, sir, I do. And I said, I got my daughter, and he explained this whole situation. I said, I don't know, but let's do an EEG. And I did an EEG, sent it off to Dr. Jonathan Walker up there in Dallas, who was a neurologist I worked with. And he did the EEG on her, came back. We had a set of protocols, and we worked with her for about 6 months. And we got a little bit of short-term memory back. At least she could tell me my name from one session to the other, where she couldn't tell me 2 minutes later after in the beginning. And her dad said, I'm not quite, we're not quite there. You got any other thoughts what we could do? I said, well, I have an idea, but let me bounce it off my international group. And I belong to so many international societies. So I contacted my Europeans and I said, I got this idea. I think the reason we may not be successful as we want to be with doing neurofeedback, because I think that in that 9 minutes, the brain died. And so we may have blood flow through the area, but we've got non-functional, non-metabolizing brain matter there. And I can't wire through dead brain. I said, do you think we could possibly do like a PET CT and see what's metabolizing? And the guy said, that sounds very logical. Let's, who's going to pay for it? I said, the dad's got money. I'm not worried about that. So I contacted a neuroradiologist here in Houston, Dr. Fisher, Ron Fisher, and I said, Ron, I got this case. I said, can you do a PET CT for me on this case and tell me what's dead and exactly where, so I know where to target my neurofeedback? He said, sure, I can, but who's going to pay for it? I said, don't worry about it. The dad will pay for it. So he did it, and we came back, and he identified this whole area, and that's why I know female brains die differently than male brains, because they have to preserve the species. And so, of course, I was trying to wire right on top of dead brain, and it didn't work. So I went and I started doing jumpers around with my neurofeedback. And she's now, this is 2005 when I was doing this case, and she's now living almost independently, and memory's back, and she's doing much better than she was. It was a case where we just had to do a logical approach with the neurofeedback in order to help this person gain some of that memory back. And we did it. So I say there's always ways that we can do something. We just got to be the people that gets creative out there and says, okay, there's got to be a way. What can we do to improve the function? And that's been my drive all these years.
We salute you for that. That was good thinking, Doctor.
Got to think outside the box sometimes.
Yeah.
Yeah, I was just going to say it's a great story to end us with. And I just want to thank you, Dr. Ron, for your time, kind of insight, and just very digestible presentation of a lot of information.
Well, I appreciate you guys, and keep up the good work. And anything I can do for you guys down here in Houston, I'd be glad to help you out with.
Thank you.
Appreciate it. Uniquely where we are. Just remind everyone that this is recorded. You will get an email out from the group, and we really appreciate everyone's commentary, questions, and for joining us tonight. We hope you just have a great evening.
All right. Thanks, guys. Appreciate it.